Thanks for bringing your doctor's orders. I'm Nate from the lab. I'm going to be drawing your blood today. Do you have any questions for me before we get started?
No, but can you walk me through the process? I'm a little nervous.
Yes, I will walk you step by step through the process. First, can you confirm for me your name and date of birth?
Sarah Burton, 9/21/95.
Perfect. Okay. First step that I'm going to do is collect the necessary supplies. On my table here, I have all the necessary equipment already to go. So, we have our tourniquets, we have our alcohol pad, we have two different types of needles here. We have our butterfly and our straight needle. We have our blood collection tubes in the draw order, that way you don't get mixed up. And then we have our gauze and co-band. We're going to begin by finding a vein that we can use for the blood draw. Is there an arm that you prefer to use?
This one is usually the one that they help me with.
Alright.
You can try that one.
Perfect. So first I'm going to tie the tourniquet. I like to come from behind the arm like this, pull both ends tight, cross over like that. So I take the one that's on the bottom here and I'm going to tuck it into there. Creates a nice little tab. Now I'm going to palpate using my finger. As you can see, there are two good ones right here. I like to go for the one that's more straight. This one's kind of at an angle. Give it a good feel. Always use a pointer finger or a middle finger. Don't use your thumb. These two are the best fingers to feel with. I'm going to clean the area with the alcohol pad. Nice and clean. This is to sterilize and make it so there are no contaminants. Okay. As that air dries, I'll make sure that my needle and tube are ready to go. Now that it's dried out, we will retie the tourniquet. We're going to pull out our needle. Remember to have your tubes ready to go as well. Very important, you're going to pull to get some tension like that to keep the vein in place. And you're going to come very just smoothly, nice flat angle into the vein. And then we'll pop our tubes on. And as I do this, I like to keep my finger pressed against her arm so that when I go to change tubes, the needle doesn't move.
Phenomena. Phenomena. Phenomena.
Are you feeling okay?
Yes.
Alright. Now that I have filled all the tubes in the correct order, I will release the tourniquet, put the gauze pad on, remove the needle, straight out, cap on the table, into the sharps, and then we will wrap the site. And then as we mix our tubes, we can ask the patient if they're feeling okay. Are you feeling okay?
Yes, I am.
Alright. Good work. I wrapped the patient. How are you feeling?
I feel a little lightheaded.
Sometimes, due to complications in the venipuncture procedure, patients may feel dizziness, lightheadedness, or faint. You said you're feeling lightheaded. I am going to ask for someone to bring me either juice or cookies to help raise your blood sugar so that you will feel better. And I will stay with you here while they do that. Would someone please bring me some juice and or cookies for my patient? Thank you.
Sure, I'm right on it. Here's some juice.
Thank you. This will help my patient. So you're feeling lightheaded. Let me call for help. Help! Bevel down. No. No. No anchor. Ugh. No. Bad angle. No. Ah! Too high of an angle. No.
Ow.
Phenomena. Phenomena. Phenomena.